There is an estimated 70,000 heart attacks every 7 minutes, and almost 16,000 Canadians die each year as a result of heart attacks. Living after a heart attack can be challenging. There may be some diet changes as well as an exercise regime that can be foreign at first. Recovery is a process, and it takes time. Dr. Mula, what is a heart attack?
A heart attack in the normal definition for the ordinary public is a very, very severe event that happens after a blockage of an artery to the heart.
Okay, so what are the warning signs of a heart attack?
The warning signs are people will get chest pain that radiates up into the jaw, up into the arm, down into the back. Depends exactly which area of the heart is being affected. This can be sort of predated by things like pain after an activity, pain after having some meals, walking up an inclination. These are referred to as angina.
Once you have a heart attack, what are the first steps to recovery?
The first steps to recovery is recognizing that you had a heart attack.
Okay.
Very many times people are overwhelmed by the event, so the recovery is there that life has to change. So if you're a smoker and you need to make that choice that you're not going to be smoking anymore, that has to be accepted routine. You know that now you'll have to be taking medications which previously were not part of your daily routine. Suddenly you'll have between 5 and 10 medications depending on what the conditions were diagnosed. If you had congestive heart failure immediately following the heart attack, that would require extra medication. But generally, patient will leave with 4 medications, one for blood pressure control, which also protects the heart, some that will control the heart rate, which are called beta blockers. Some of them commonly known to people like atenolol or metoprolol, but you're going to have an ACE inhibitor or an angiotensin receptor blocker medication, which have proven that they do prevent secondary heart attack. People are going to need to take aspirin after that. So the medication will be there. Apart from that, you're going to have to abide by a more stricter diet, and the stricter diet means obviously cutting out some of the things which led to your heart attack in the first instance.
Now you just focus on the physical, but what is the emotional health after a heart
The
attack?
emotional health is there are people who adopt the sick role, and they do have a condition which is called post-cardiac neurosis, that every time a person gets a little discomfort in the chest, then he's going to think, oh, I'm having another heart attack. It can be a simple thing like a reflux heartburn, a gastroesophageal reflux condition, and then the patient will assume the sick role and then return to a hospital for every subsequent chest pain. It could be musculoskeletal chest pain. So then the person is spending more time thinking about his disease rather than trying to rehabilitate himself to get better and be, having. So this type of thing can cause significant depression.
And that leads up to my next question. What changes are the most challenging for a person once they have had a heart attack? Is it diet, really?
Diet is one of them. We know the risk factors. Over the years, we've been studying heart attacks and also other cardiovascular diseases. We have a calculator that we've been using over the years called the Framingham risk calculator. Most of those relate to either age, gender, but most importantly, it relates to your levels of cholesterol, levels of diabetes, and your blood pressure. So if we can control any of those, that would be the most important thing. So if obesity is going to be leading towards diabetes and hypertension, and also the other complications of it, then we're going to have to address that lifestyle change that we require to go back to and make sure that we don't have a significant change.
I'm here with Lori, who had her heart attack in 2013 on May 13th, and she's with her program and she's doing a little bit of cardio at the moment.
Right now I'm just on the stationary upright bike.
Now, is this one of your favorite, because I'm sure you do a few other things for cardio, is this one of your favorite exercises?
I don't know if it's my favorite. I love the elliptical, which is that machine over there. Sorry.
No, that's
I like them all though. When I first started, I was so hesitant because having the heart attack is a life changer, and I wasn't sure I would be able to do what I'm doing now. Wow. And yeah, it's just all been for the best.
So exercise prior to your heart attack was non-existent?
In my early days, it was very existent, and then I guess, yes, I became a couch potato. So yes, when I started here, when Phyllis met me for the first time, I thought, I'm never going to be able to do this. And now I'm doing so much more than I ever thought I ever would do.
Now, Lori, we're doing the chest press. Is this the resistance program too, a part of your program? Is this something you like to do?
Yes, I do like doing the weights, but I do prefer still the elliptical.
I can appreciate that. Now, I wanted to touch a little bit on diet. Since your heart attack, I'm sure your diet's changed a little bit. What has that meant for you? How has that changed your life and maybe your ability to move around?
I'm eating a lot healthier than I ever ate. I appreciate the healthy food now. The taste is so much more, not stronger, I'm not sure what word I'm looking for, but I enjoy food so much more now.
Okay, so let's share with the audience what we're doing and why we've chosen a few ingredients.
Sure, we have some organic spring mix or greens. I mean, depending on the time of year, you could use anything you want. Kale, Swiss chard, sort of healthy leafy greens. We got fresh chopped herbs.
Okay.
We have a mixture of brown and green lentils that we've already cooked. If you can't find cooked lentils, it's just sort of a 2.5 to 1 ratio.
I love a legume because that's excellent. We want to try to keep the fatty meats down, especially on a diet after heart attacks. This is a great source of fiber. So good choice, good choice. Yeah.
A little bit of chopped green onion, some sort of late harvest crabapple.
Okay.
Then we have our garlic scape pesto.
Garlic, excellent for the blood. Thins out the blood, perfect.
We got some chopped apricot.
I love that. Great source of
Goat's
vitamin
cheese.
C. Oh, good source of protein.
Camelina oil.
And camelina, that's the powerhouse antioxidant. We talk about that sometimes, and you need antioxidants. That's very important to keep everything in check. Your blood, we know this, right? Mm-hmm. What camelina oil do? I'm testing him today.
It's good for you.
It's good for you, baby. Helps you lower your blood pressure.
Has a lot of omega-3, I think, in it too.
Omega-3s, yes.
Olive oil does not.
Absolutely. Have you learned a few things since we've been doing these shows?
Yeah, sort of.
Okay, that's good to know. Has your diet improved a little?
Learned that I don't like getting up early.
Yes, we're here at the crack of dawn. No, we're not.
So we'll start with some apple.
Okay.
Just for, dramatic effect, that sizzle going on. So apricots as well. Just to sort
And
of
that just softens them a little?
plump them up.
Oh, okay.
I'm going to throw almonds. I wouldn't put all those almonds in there, but
All the almonds in there.
pretty close to all of them.
Yeah. I love it because it's becoming very colorful now.
It's good for a sort of fall dish or something.
Yeah.
If you want to use kale, like we said, or Swiss chard.
Absolutely. And I love lentils. I know not everybody likes lentils. My husband hates lentils, but they have a very distinct flavor. I don't know. I think they're quite good. What do you think about lentils?
I like lentils.
I like lentils.
Good.
So if someone doesn't like lentils,
If you cook them properly.
That's the trick. So what happens if you don't cook them properly?
They turn all mushy.
Yeah.
I'm going to hit that with some more camelina oil. So try and get some more sort of color in there.
And I love camelina. It's heart protective. We talked about that. It's the powerhouse antioxidant because it lowers blood pressure naturally. So if ever you want to add that to your, do you put camelina oil in most things?
Yep.
Yeah, because I've noticed most of your recipes have it. Okay, so you actually put it in there.
Yeah, I'm not going to probably put this back on the heat. If you were doing sort of kale or Swiss chard, you would put it back on the heat.
Because it's a really,
Because you want it to sort of soften up.
Yeah, this is quite soft. I
So
like
I'm
it.
just going to sort of leave that be. Add a little bit of cheese.
And you know what? Cheese is good. Yes, most of it is high fat. Goat cheese is pretty good in terms of fat content. But it has a great source of protein as well. So I like that cheese.
You don't need very much. Just
No,
sort
you
of
don't. Just add a little bit of a.
little bit of zip.
And it, like, what's nice is that because the meal is hot, it'll just melt nicely,
Yeah, it's
right?
soft
so
too.
It's been out
Sort
for a
of
while.
coming to room temperature. So
Is that the best way to use it?
it'll melt quickly. If you're looking to melt it, if you sort of wanted it on a salad, you'd probably keep it cold.
Okay.
If you wanted to sort of melt it in with your greens.
You know, when you look at it, it looks like whipped butter. You can't even tell. So we have our warm lentil salad here. So the almonds, omega-3 fatty acids, very high in fiber. We have our lentils. So even though you've had a heart attack and you're recovering and you're trying to make sense of what to eat and what not to eat, just so you know, there's a lot of tasty things that you can eat. Just try to keep it low fat, high fiber, that's really important, and try to choose lean protein sources. And don't forget those legumes, such as the lentils. Really good choice. Okay, so it's not dire, it's not that bad. When my dad had a heart attack, we did adjust a few things, but he's wonderful and he's going to be 89 and he had his heart attack at 55. So it's just to tell you, life after heart attack is still a good life. All right, let's try this.
Dig in.
Spoons. No forks.
Nope. Not for
Okay,
this.
not for lentils.
Not for salad.
Because it'll fall over my fork. Am I guessing that's why?
Sure. Mostly because I didn't have a fork.
I love Tim because he's so honest.
Oh, good.
Recovery from a heart attack can be a long process, requiring you to make big changes in your life. You may need to change how you eat, begin a new exercise program, take new medications, and visit your healthcare provider on a regular basis. However, these treatments can help you lower your risk to having another heart attack, reduce your risk of death from heart disease, and often increase your ability to exercise and be active.